For the next 3 weeks, we'll be focusing our attention on pregnancy, what you need to know about prenatal care all the way to delivery day. We'll also touch base on how to handle a pregnancy through this coronavirus pandemic. Dr. Jeffrey Thomas is an OBGYN and the Chief Medical and Quality Officer at Community Regional Medical Center. He joins us via Zoom to chat about how to prepare mentally and physically for a baby. Doctor, we are talking about pregnancy 101, all there is to know about expecting a baby. Talk to us about what a woman should do as soon as she finds out that she's pregnant.
Well, let's talk about before you find out you're pregnant. One of the recommendations for prenatal care is that if you're thinking about becoming pregnant, that you go ahead and start taking a prenatal vitamin. The other recommendation is that women take 1 milligram of folic acid a day. That prevents spina bifida and some other birth defects. So if you can get on those, if you're trying to get pregnant, it's a good idea. Understand that if you just barely became pregnant, there's not a whole bunch to do, but to go over some precautions, dietary and such, give you some warnings about things to look out for. Generally, an ultrasound is performed between 8 and 10 weeks to confirm the pregnancy is there. So if you just found out you're pregnant and you just missed your period, probably not going to do much, but say hello, give you some information at that first visit.
Excellent. And what can a woman expect when she does go to that first visit and sees her doctor?
Depending on how far along a woman is, some people will order their initial laboratory assessment. We usually give a roadmap of what the pregnancy will entail, how often the pregnancy visits will occur in the office, what kind of ultrasounds, lab tests, other surveillance will be performed during the pregnancy, and just general do's and don'ts. A lot of what we do is dispel myths about things that people have heard that are definitely not true during pregnancy.
Let's talk about some of those do's and don'ts. I know that you had mentioned nutrition earlier in our conversation. So what can a pregnant woman eat and what should they not eat?
Right. So, a lot of people think that when they become pregnant, it's a time to change things and to quote unquote get healthy. The general recommendation is that women maintain a balanced diet. The whole adage of I'm eating for two doesn't necessarily hold. In general, you should increase your calorie intake moderately in the first trimester. As a rule, 1,800, 2,000, and 2,400 calorie a day diets for first, second, and third trimester are recommended. We would hope that your weight gain is not over generally 20%.
Doctor, how important is prenatal care and why should it be so emphasized when you're expecting?
I think that, one of the things that we see in third world countries or in places where prenatal care is not readily available, even with some of the disparities in healthcare here based upon socioeconomic status, those conditions which are preventable, like diabetes in pregnancy, which can lead to complications both at the time of delivery and for a baby after delivery, things like preeclampsia, where it requires monitoring of the patient's weight, what the urinalysis shows, what the blood pressures are, that education, and also education about preterm labor. At night, we have a lot of patients come to the hospital or during the daytime too, and the question always arises, why didn't you come in sooner? And a lot of time it was just about the education, about the understanding of what to look out for. So even though some of these things are inevitable and not related to behavior, weight gain, or risk factors, just knowing what to look out for can help you get into the doctor or the hospital earlier to seek treatment that hopefully we can help you out and prevent a bad outcome.
Excellent. Great tips for pregnant women, those who are expecting. We appreciate your time, doctor.
Thank you.